I know I'm being very emotional about this, but this means a lot to me. Because sometimes we fail in things, and we fail, but we try. Sometimes we don't even try. This time we're really trying, really trying to build in that. And all of the agencies involved, from the top right down to the bottom, are important. In many ways, the baton will be handed over time. I mean, we need to develop more vaccines. We shouldn't stop. We need more than these 3 or 4. Yeah. We need to increase production. We need to pull the price down. We'd love a 1-dose vaccine, because all of the vaccines so far are 2 doses. So the innovation is not finished. We need the research to continue, and we need everyone to support that research. We need everybody to look into their own hearts and see how can they contribute. If you're offered a vaccine, it's not just for you. You represent that new firewall. You're a tree in the forest. If you don't burn down, the rest of the forest doesn't burn down. So your responsibility in this is not just to yourself. It is to your community. So everyone, before the vaccines arrive and all the arguments start, over this holiday period, I'd advise everyone to sit down and find out all they can about vaccination. Find out all they can about the benefits. Find out all they can about the risks, and make a good decision. But make a decision for you, make it for your family, make it for your community, and make it for the world. And remember, each and every person is a tree in that forest. And you get to choose, and you should get to choose. But you're also part of a forest. So let us try also over the coming weeks, not just think about the technology, but think about the psychology that we need to have to make vaccination successful.
Thank you, Mike. I have a follow-up question, and the inspiration comes as well from one video. It's not the recent one. We made a lot during this year. I think this was about the springtime when we made a video of you saying that from this big threat that we are facing, we have opportunity for the humanity working together to make a new vaccine, but we need the health workers to deliver those vaccines, and we need people to accept to receive this vaccine. So this relates back to vaccination, and maybe you can give a comment to that as well. You mentioned how many decades it's taking us, and we are not at the end of polio and other diseases. So maybe the role of health workers, and we know they are tired, exhausted. This has been long. We have a big shortfall of health workers even before the pandemic. And also we have people on the other side who are concerned that this has been a short period of time to develop a vaccine, to ensure that they feel secure, safe to receive this product.
Yeah, it's a very good question, and we will ask our frontline health workers once more to lead, and we'll follow. Up to now, the frontline workers in the hospitals and in the intensive care units have been the ones who've led and gone there bravely and courageously every day. Our surveillance workers have gone out and tried and detect disease. Our laboratory scientists have, we forget some of these other people whom we call frontline workers. What about those laboratory workers? Some of them spending 22 hours a day in the lab with thousands of samples arriving in, no break. They're going. They're just as much contributing to this. Now we're going to rely on a different set of workers. Those vaccinators, those planners, logisticians, people who maintain the cold chain, the people who go out and mobilize communities. There's a whole other set of people who operate within the health system. And very often these are much more the front end, the primary healthcare workers, the people who work in the deepest level of communities. And very much they're the undersung people. We physicians sometimes get the visibility because you see the doctor in the white coat or someone in the surgical scrubs with all the gear on in the ICU, and there's a respect for that. But the real people in a vaccination campaign that matter are very often, in many countries, the community health volunteers, very often women, 95% women in most cases, who go out there and work with the communities to educate people on vaccines and what they do, and convince people and persuade and enter into dialogue. And they're the real experts in my view, because they're the people who create the social demand for vaccination. They're the ones who understand how a community is going to react to vaccination, and they're the ones who can advise the vaccinators how best to set up the campaign so the community can accept that campaign. So there's a really important work to go on now, and that's why we need NGOs and civil society now. This isn't just a medical response. Successful vaccination campaigns are partly medical, they're partly logistics, but they're all about communities. We need all hands on deck. everybody should be part of a vaccination program. It's like an election. Everyone gets to vote and everyone gets to participate. And it needs to be a participatory process. Communities should see this. We spoke all year about science, solidarity, and solutions. Well, we've done the science with wonderful organizations like CEPI and Gavi and Bill and Melinda Gates Foundation and so many others who've worked upstream, and all of the companies and who've worked, the ones like Pfizer and J&J and I'll forget people now and I'll be killed, Moderna and all the others, our colleagues in China and our colleagues in Russia. Many are contributing to that, right? And that solidarity has led to the development of packages now that can be delivered to countries, vaccines that can be delivered. So we have potentially the solutions, but we have to deliver those solutions. And that's going to be the trick. So I think each and every community should be sitting down as a community and saying, okay, how are we going to access vaccine? How are we going to use this vaccine? Because it is about we. And I don't think people should externalize this and make this purely something that the state does, that we have to accept. Communities should be generating their demand for vaccine and prioritizing who gets vaccinated. And one of the things that's come through in much of the policy decision, and our SAGE, the wonderful group, our Strategic Scientific Advisory Group in Immunization, which is run by Kate O'Brien, our colleague in immunization and vaccination and biologics, they've been looking at the priority groups, looking at who should be vaccinated first in terms of underlying conditions, older persons, health workers. So the first wave of vaccination is really aimed at protecting those people who are most likely to die or most likely to get very sick if they get infected. And then after that, the vaccination will be widened out to broader sections of the community. So the first thing we will see with vaccination, hopefully, is that mortality rates rise. The number of deaths should start to fall. But the number of cases may not start to fall as quickly until we get many, many more people vaccinated. And what we don't really want to get to is a position where we have relatively low mortality, low numbers of deaths, but we're not vaccinating enough people to have full control on the disease, so that the disease keeps circulating and putting people at risk. But we're not getting enough people vaccinated to contain it, control it, and get rid of it. And I think that's going to be the challenge. I think we will have very high uptake of the vaccine in older persons and persons with underlying conditions, because they know the price of being infected. I think we're going to have to do a lot of work to get others, particularly younger people and others, to accept that vaccination is a really positive thing for them to do on their own behalf and on behalf of their communities. Much work to do.
Thank you so much, Mike. And you mentioned we expect eventually that vaccine to see as a result decrease in deaths, firstly. We don't have the vaccine ready yet to be delivered around the world. So maybe, Maria, you can reflect a little bit on current trends in number of cases as they are still growing, but also on success in treatment and mortality rates at the moment around the world.
Yeah, so we are seeing success. I mean, as you've said, as Mike said, the vaccine is, I mean, we have wonderful news. We have great news coming online, and that we're taking the right steps towards getting people to become vaccinated at some point and having that countries get ready to be able to do so. But there's a lot that we can do now. All of these trees in the forest, all of us that are there's a lot that we can do now to prevent infections in the first place. The best treatment we have out there is prevention. First and foremost, you know, the best drug that's out there is prevention. Prevent yourself from getting infected. You know, prevent somebody from developing disease, to prevent somebody from developing severe disease and dying. So there's a lot that we can do right now. There are some good trends that we're seeing in many countries. And again, this is another sign of hope that you hear Mike and I talk about a lot. Countries are controlling COVID. They're controlling transmission of COVID with the interventions we have now, which is a combination of individual measures that we have. Physical distancing is really, really critical because this virus most often spreads when you're in close contact with other people. Hand hygiene, making sure you clean your hands, make sure you wear a mask. And when you wear a mask, you wear it safely, that you have clean hands when you touch your mask, when you put it on your face and when you take it off, making sure that your mask covers your nose and your mouth. Wearing a mask under your chin doesn't help anybody. Making sure that if you're in an enclosed space, you know, that you open the windows and you improve the natural ventilation. practice respiratory etiquette, avoid crowded settings, think about all of your actions that you make every day. All of that limits the spread. And so that will need to continue. And I think that will need to continue for many months as the vaccines come online and as vaccination starts. But it will take some time before we reach enough of the population to see that impact of vaccination. But the trends that we see across Europe right now, a number of countries are starting to see a reduction in transmission, a reduction in case numbers, and this is a great sign. And there are a number of countries that are doing this. But that has come at a great cost because there have been quite a few stay-at-home measures that have been put in place. Some of those are being lifted now. So it's really critical now that countries that are lifting some of these measures, that everyone still remains vigilant. We cannot let our guard down. If we let our guard down, it will spread. The virus has not disappeared. We do not want to be in another situation in Europe, for example, after the spring, when there were a lot of stay-at-home measures. Over the summer, we had low levels of transmission. People behaved in a way as if they wanted the virus to be gone, and it wasn't quite gone. So it found an opportunity to spread again. We don't want to be in that position. And especially as the holidays are coming up for much of the world, we need to make sure that we limit our interactions with others. And that's a hard message to say over the holidays. But I think this year, in 2020, we need to really think carefully about the end of the year celebrations. And then you asked what are the trends in a number of countries. Transmission remains low. Many countries across Africa, many countries across Asia have really low levels of transmission. And they can keep it low, and they are keeping it low. So that is really a good sign. And unfortunately, we have some countries that are really seeing intense transmission. They're in the middle of a surge, and they're going to see even more transmission, I think, in the coming weeks and in the coming months. And those countries in particular, this is going to be very difficult, a very difficult winter. But we will get through this. So all of us have a role to play. All of the decisions that each of us make contributes to either spreading the virus or contributes to limiting that spread. And so we need to think about everything that we do every day to be on the side of that equation of limiting the spread of the virus.
Thank you very much, Maria. There is a follow-up question from one of our viewers. Speaking of winter season in Northern Hemisphere, is WHO considering some new and effective methods to fight COVID-19? So do we have any fine-tunings depending on where we are at the moment and the weather season that we are facing?
Yes, we are always fine-tuning our guidance, and I really like that word, fine-tuning, because and as you've heard us talk a lot about the science of this virus, we didn't know anything about this virus a year ago. It's pretty incredible. It's astounding, actually, how much we've learned and how we have applied that science, that data, that evidence into guidance. So we're always fine-tuning that. We published today or yesterday updated guidance on mask use, for example. And this is an example of fine-tuning guidance over the last year. And we have issued updates on that, of looking at the use of masks as part of a comprehensive package. It's one tool of many that can be used to help prevent the spread of COVID-19. But again, it has to be worn safely. It has to be combined with good hand hygiene before you put it on and after you take it off. And yes, we have fine-tuned that. I think a lot of people are looking for the shiny new object, the next innovation, the next thing. But I think what we need to try to find a way is making all of these existing tools really exciting again, because these are really powerful tools we have now. The vaccine will be another powerful tool that we have, but we did issue some updated guidance on masks yesterday.
Thank you, Maria. Some viewers are asking why we are not wearing masks, so maybe you can explain again, and as well, what do we need to do more when we are spending time indoors? And I think some of the viewers were asking, what are the riskiest settings during winter that I should avoid?
Yeah, so there are riskier settings, than others. And if the virus is circulating in your community, because again, the global situation is not the same. So in areas where the virus is circulating, the virus spreads most efficiently between people who are in close contact with one another, and especially in indoor settings where you have poor ventilation. And you've heard us talk about this before. This is a respiratory virus, and the virus can be released from me when I'm talking, when I'm singing, if I cough, if I sneeze, and it can pass through the air from me to you, and especially if we're in close contact with one another. And the particles are a different size. The droplets are different size. The bigger ones are called droplets, and the smaller ones are called aerosols. And that can pass, and the virus, if they're in those, can pass from me to you. If you're in an indoor setting that has poor ventilation, the possibility of these aerosols generating and building up is higher. And so it can become airborne in those type of situations. And it behaves opportunistically. It takes the virus in these it takes advantage of that type of situation. So that's why we say open a window, and improve the natural ventilation in that space. First of all, avoid it if you can in the first place. But in our new guidance for masks, for example, that I just mentioned, one of the new recommendations, updated recommendations, is if you're in an indoor setting and you don't know if the ventilation is good, wear a mask. Put on a mask until you know there's good ventilation. This includes public settings, so if you're in a shop and you don't know, wear a mask. If you visit somebody's house that's not your own house, and if you're with people who are outside of your immediate family, wear a mask. And again, this is mainly for source control, because if we don't know if I'm infected and I'm feeling fine, we know the virus can spread from people who are asymptomatic, which means they don't develop symptoms, or they have not yet developed symptoms. So it's important to wear a mask for that source control. But in the first place, if you can, avoid risky settings, indoor, crowded spaces for long periods of time where there's poor ventilation. The virus really likes that type of setting.
Thank you, Maria.
And we all know those settings. Have you ever sat in a room and think, well, this place is very stuffy?
Yeah. Yeah.
If you're in a room and you think it's stuffy and there's a bunch of people in the room, that is just not the place to be.
Yeah.
And in a room when you feel there's ventilation, I can hear our ventilation here, and I can actually feel the airflow because it's pulling the air upwards from behind me here.
You can see
and I can feel the actual airflow on the thing. So we know there's a good airflow here. And because of that, we have our masks here in our little bags. I walked in here with a mask because I was in the common area. So what we're trying to do at WHO is do risk management through the whole cycle of the day. And we look at the day, and our days are unfortunately a lot longer than 8 hours. So what we're trying to do all the time is, for example, even myself and Maria, if I've got 8 o'clock morning, we have our health ops meeting. Well, many of us will actually do that from off-site, right? Because we don't want to pack into the room. So we only have because I actually don't necessarily attend that meeting because I'm not central to that meeting, but I need to know what's going on. So rather than be in the room, I dial in by Zoom into the meeting. I get all the information I need, but I'm not exposing anyone. I'm not exposed myself. In my office, well, I'm a pretty large office now. And it's a big place. But my rule in my office is both windows are open, which means it's freezing. And the maximum number of people in my office is me plus 2 or 3 maximum others. So we've taken the chairs out of the room, so it's not possible to have more people sitting down. So we're doing the same stuff, and it's just as annoying as it is for me as it is for all of you. And then if I want to have a meeting with 4 people, I've got to organize a big meeting room because it's more than the 3. But that's the way we manage those. And for example, there are smaller modules here, single office modules, and our rule is nobody can have a meeting in those rooms. Only one person can be in those rooms. So everyone is adapting, and we've had to evolve that advice over time. Now, if you think about that for yourself in your day, it's the same thing. It's about, I've said it, if you're coming up to Christmas and the normal, or Thanksgiving is just gone, and there's 14 people in the kitchen all preparing dinner, that's not safe.
Right.
So it may be that mom or dad needs to take control and have people doing parts of the kitchen chores in other rooms. So it is about breaking it down and seeing what's safe. Maria said it, the distance is key. The number of people in the space, the amount of time you're in that space, the ventilation in that space. What a mask does is it effectively gives you virtual distance. By wearing a mask, you're actually almost, the person who's closer to you is virtually further away because less of their droplets or less of their aerosols can reach you because you're protected and your droplets aren't reaching other people. So in effect, you're creating a virtual extra distance between you and that other person. The other thing you could think of is if you imagine yourself as a sort of a sponge. I would hate to put the analogy as a viral sponge, but in a sense, everyone to get sick needs a certain minimum number of viruses to be exposed to in a given period of time. It's not usually one virus that infects you. So you need this sort of concept of saturation or an infectious dose that you need to get. So if you think about it, there's some critical number that we don't know, but we know that if you're in a room with lots of people over lots of time with poor ventilation and you're not wearing a mask, you're going to get relatively exposed to more virus. In other words, your body absorbs more virus in that time and in that place. If you can keep your level of saturation with the virus below a certain level, then your chance of becoming infected with a low level of exposure to the virus is much, much lower. And it's about keeping your individual risk below some level. If you imagine trying to play a computer game, if you're trying to keep the cursor below a certain point and trying to, and if you look at every activity you do in your life, it will either increase your risk of having a significant exposure or decrease. So if I'm going to the shop and I decide I'm going at 6 o'clock in the evening when everyone shops after work, then my risk is going to go up because there's going to be 60 people in the store. But if I decide to go to the store at 9:30 or at 10 o'clock in the morning, then maybe there's only 5 people in the store. My risk goes down. So the same activity can have a different risk profile depending on when you do it and where you do it. Yeah. And I think people just need to sit down and work through those issues. Because you keep your risk below a certain level, you don't infect anyone else, they don't infect you, the numbers drop. Yeah. And all these lockdowns are doing is effectively imposing that on people.
It's quarantine for everyone.
It's quarantine for everyone.
Instead of quarantine for some.
And what we need to do as we come out of these lockdowns and quarantines, community quarantines, as we come out of them, we have to follow through. Yeah. And we need to follow through on those behaviours that keep the risk low, without swinging and springing back in to the high levels of transmission that require lockdowns. And people need to realise that we're not going to have sufficient vaccination in place to prevent another surge of cases for at least another 3 to 6 months. That's the fact. So those countries now that are winning the battle and getting the numbers down, everyone needs to realise that those numbers will not stay down unless we keep doing the smart things. Those numbers will bounce back up and we'll have another wave before we get to vaccine, and more people will die and more health workers will become exhausted. So I think I'm actually more and more hopeful, because I'm actually seeing each time we seem to go through this, people are getting it more and more. People are seeing the benefit of actually following through on those activities. And I would say as well, we don't want to make this purely about individuals, and people's behaviour. We say the riskiest settings. The government and private sector and others have responsibilities to make those settings safer too. It's not just my responsibility. Disinfection on public transport, limiting the number of seats available on public transport, blanking out seats. There are things that the government does and the private sector does that help us or hinder us, right? Yeah. And we can be hindered by the government, or we can be helped into doing the right things. Yeah. And we need that help and support. And thirdly, we better not forget that we keep needing to do testing for this virus, strategic testing. We need to increase testing. We need to increase our surveillance. And ultimately, if we can identify a higher proportion of the cases and we can quarantine all of those contacts, then the risk levels at community level go down significantly. So we need to keep all of those activities up while now planning for vaccination. So we need to, this is juggling now, this is juggling for experts, because we've got, public health surveillance, and we've got personal behavior, now vaccines, and we got to do this for the next 6 months. And it's not easy. Maintaining all of that activity at government level, at science level, at community level, doing that together, we finish this, and that's the prize. Who wants to get back to work? Who wants to get back to school? Who wants to get back to living your lives as you knew them before? That is possible now, given what we've learned about the virus, given the advent of vaccines, given what governments can do and have been shown to do in terms of being effective. So I'm going into this coming holiday period with great hope, great sadness for what's been lost, and for those families who've lost loved ones, with huge sorrow in my heart for that, but with a great hope that we've learned enough to do much better and to finish this.
Yeah.
But it won't finish by itself. This virus doesn't just go away.
No.
We make it go away.
Thank you, Mike. There are a lot of follow-up questions. I think I'll read a few on masks. One is, what about different types of masks that exist? Does the one with valves works better? And there is another one, do we still need to wear a mask after getting vaccinated?
That's a good question. Yes, so there are a lot of masks that are out there. And in fact, in the guidance that we have, we've updated our recommendations on how fabric masks, non-medical masks, can be worn. Actually, that's a very exciting area of innovation. At the beginning of this pandemic, we had very little information, if any, on non-medical masks. And we've seen an explosion in terms of research that's looked at the different layers and the different types of fabrics, making sure that it still provides the same type of source control with a filtration layer in the middle, which fabrics help with breathability. So there's a lot of really good innovation and research that's out there. We don't recommend masks with valves because if you have that valve in there, it allows air to go through and it defeats the whole purpose of the mask itself. So we recommend medical masks for health workers, for people who are sick themselves and people who are caring for those who are sick. And we recommend non-medical masks or fabric masks that have at least 3 layers and have a filtration layer in the middle for everyone else. And again, what we're trying to do with masks is add this as a tool, as one of many that can be used where the virus is circulating. Many people want to know, why don't you just say everybody wear a mask all the time? Well, it's contextual. It's really important that we wear them where appropriate so that it helps the spread. And so there's a lot of locations where that is, and it's outlined in the guidance itself. So there's fabric masks or non-medical masks, and there's medical masks themselves. The respirators are not actually a mask. They're actually called respirators. Those are for medical professionals who are carrying out certain types of medical procedures, who are in ICUs, carrying out, or where there are these aerosol generating procedures that are done on patients. And we recommend respirators for those medical professionals. But I do want to highlight one thing. The world has really stepped up and increased production of personal protective equipment and masks in particular, but we have not solved the problem. There still are shortages of masks. It has improved greatly since the beginning of this pandemic, where we had a complete market failure on this, but it isn't completely solved. So we still need to make sure that production increases and that we make sure that medical professionals, health workers, community care workers, anyone working with potential COVID patients has the right personal protective equipment, which are masks, which are eye protection, which are gloves, which are gowns, which are respirators, in certain areas. So it is important that we still continue to do so. And I think that's really important.
Yeah, just to add on valves, because I think we have to remember that the world of masks was not designed for COVID. If you look at who wears masks in our community, very often it's frontline health workers, but it's also people working with hazardous materials,
right,
people working on construction sites. And very often those masks have valves, because you're not worried that the construction worker is going to give you a disease. What you're worried is that the construction worker is going to be exposed to a hazardous chemical, right, or something else that may, asbestos or something that may go in their lung. So the mask acts as a filter. As they breathe in through the filters that are in the mask. And as they breathe out, it's the valve that allows the air to breathe out. So it allows them to work very effectively because they can exhale very comfortably. And in doing that, they're not breaking the pressure seal on the mask. The mask stays perfectly fitted. So as you breathe in the air, the mask is very sealed and the seal improves. And then as you breathe out, you can break the seal on the mask because you put pressure on the mask. It acts like a parachute. And the beauty of the valve is that it allows you to exhale under exertion, but not break that seal. So it's a kind of a way of getting all the air out of the system. But that air that's coming out is from the worker. It's not necessarily filtered as well. So the danger is that if you wear a valved mask, you may actually, if you're infected, you may just be blowing infected aerosols. In other words, it defeats the purpose of wearing the mask. It's not dangerous for you, but it just defeats the purpose. Right. And I think that's the important thing about valve masks. And the same, and in general, if health workers are wearing valve masks, it's for the same reason. When health workers are wearing valved masks, if you're talking about working in an Ebola ward or somewhere like that, everyone in the Ebola ward has Ebola. It's the health workers who don't have Ebola. So what you want to make sure is they're as comfortable as possible. So there's been a lot of adaptation of masks from other areas into this space. And I think there will be a need as we go. And we are looking at this now, looking at innovation in protective gear.
Yeah.
Because we're expecting, I've seen in Ebola, I've worked in Ebola wards myself, I guarantee you spend a couple of hours in an Ebola ward at 110 degrees with Fahrenheit, yeah. Yes. But if you're doing that in a 100% humidity, and you're in a first layer of medical gear, and then you're on another layer of a jumpsuit, and then you've got a plastic cover over that, and then you've got a hermetically sealed mask, and you've got goggles, and you're in Wellingtons. I've come out of those wards literally with my Wellingtons full of water, which is sweat. It's very hard to work in those environments. And you've seen the workers on TV with the PPE on. It's frightening for the patients, it's frightening for the workers, it reduces your capacity to work effectively. You see when you see so many different designs, no design is perfect. We haven't really come, I think, to a perfect combination of protective equipment. And equally, I think we'll have to look in the aftermath of this pandemic. And again, the innovation that's come from communities around fabric masks and people who've really become activists for that, we need to look at that as well, around how we can learn from that kind of community-based innovation and react quickly to those movements that come up. I mean, we would have had a medical mask approach up to now. In other words, we'd have said we will wear masks or don't wear masks. Maybe we underestimated the power of communities to make their own masks. And I think that's something we need to look at in future.
It's really exploded.
Is grassroots PPE. So I think it's interesting. All of that's really interesting, but really important that people understand that the valve thing is not protecting. It's not protecting others.
Yeah.
Thank you very much. This was a great explanation. I think, Mike, you have another commitment in 1 minute, so we have 1 minute to close this discussion. I thank you very much for all your time, not just today, but throughout the year, and to all our viewers for watching us and for asking their questions. I can see that the positive energy is coming back, and that we're seeing more innovative solutions, whether it's on vaccines or on a medical side or on a community level, and other solutions on masks. So what is your closing message today, looking into those positive signs and solutions that are coming from all over the world?
It reminds me of the scene in Shrek, where Donkey is in the back going, "Are we there yet?" And how annoying that is, right? Well, I'd just like to say we're not there yet. We're nearly there, but we're not there yet. And we're going to have to be very patient with each other over the coming months. We've got to keep it up what we're doing now. There are lives that will be lost if we don't keep up what we're doing now. And then when the vaccine comes on stream and full, we'll be able to save more lives. But we need to save the lives we can now, not the lives we promise to save next year.
Yeah.
Don't promise to do something next year that you can do today. Keep yourself safe, keep everyone else safe, and then the vaccines will really make a difference.
Yeah.
The vaccines are not a replacement for good public health. They're a massive addition to the armory we need to defeat this virus.
Yeah, and I think it's a time to be hopeful. I mean, I think we can tell everyone, our message is to be hopeful, but we have to put in the work. So this is not going to go away on its own. We need to, all of us, put in the work as individuals, as families, as communities, as leaders, and whether we're political leaders or religious leaders or youth leaders, all of us have to do the work. And one of the things we're trying to tell everyone everywhere is know what your risk is and take steps to lower that risk, because you have the power to do that. So everything that you can to prevent yourself from getting infected, to prevent you from passing it to someone else, do it now. Do it every day until we get through this, because we absolutely will get through this.
Thank you, Maria. Thank you, Mike. I think everyone needed to hear some signs of hope after this difficult year. We are coming to an end of the year, but we are not at the end of this pandemic. We are not there yet. Please stay with us, follow all fine-tuned information on our social media channels, on our website. And until next week, please stay safe. All information you can also find at www.who.int. Thank you and goodbye.